Hello, welcome to week 7, chapter 7. We will be focusing on all the different types of administrative information systems that are used in healthcare. Okay, so we'll be learning all these different objectives. Okay, the first thing we'll talk about is administrative IS. This is how business is managed in healthcare. It is the first information system used in healthcare, and the data collected is mainly financial, business-oriented, not clinical. Okay, so a hospital information system, HIS, is a major IS used by healthcare organizations made up of many different administrative systems, such as the financial information system and the master patient index, MPI. Data stewardship. So this is the formalization of accountability and a continuum of stewardship responsibilities across the data lifecycle and across the enterprise. It is carried out by a network of designated employees who are responsible for managing, collecting, viewing, storing, sharing, disclosing, and using of personal health information. So what it is when it comes to healthcare is the management and responsibilities of an activity according to its established goals and objectives, regulatory and accreditory conditions, and other organizational obligations to guarantee that health information is used appropriately. Okay, so when we talk about different administrative information systems, excuse me, these are all the different types. We have a financial one, human resources, decision support, MPI, patient registration, scheduling, practice management, materials management, and facilities management. Okay, so the financial information system, it's critical to the fiscal health of a healthcare organization. The organization must receive accurate financial information in a timely manner to monitor and manage finances of the healthcare organization. Information can be used to plan and control the expenses of day-to-day operations and long-term investments. Revenue cycle management. So this is important when it comes to HIM because this is typically something a department we work in. So the revenue cycle is a very complex process involving several departments and many employees. The main tasks are reviewing services provided for claims, reviewing outstanding claims, return claims, denials, missing accounts, bill holds, and anything related to revenue. So when we're talking about financial information systems, we're talking about patient accounting, accounts receivable, accounts payable, general ledger, investment management, contract management, payroll, and billing and claims. Charge master, this should sound familiar from previous classes last year. This is a financial management form or software that contains information about the healthcare organization's charges for the services it provides to patients. So this is also called a CDM, Charge Description Master. So periodic updates are required for a charge master. The coding system codes, so classification system, have to be updated annually, just like codes do. HIM professionals are involved in this process to ensure the charge master updates are completed annually by the hospital's information systems department when updates are received. Okay, diagnostic and procedural coding. This should be very familiar to you. So coding professionals are in charge of populating diagnosis and procedure codes through direct data entry or from an interface to an encoder. HIM and coding staff have always played a big part in the financial status of a healthcare organization because coding leads to reimbursement. CDI, we talked a little bit about this last week. This is a process that's an organization undertakes to improve clinical specificity and documentation, which helps coders assign more accurate codes. Quality of documentation is vital for good patient quality care to meet regulatory requirements and obtain proper reimbursement. Next, we have the Human Resource IS, so HRIS. So this requires many staff members to operate. Many healthcare facilities, HR departments operate 24 hours a day, 7 days a week. Because of staffing requirements, payroll makes up a large part of the operating budget. So what do we see functionality-wise in an HRIS? They track employees for promotions, transfers, terminations, performance appraisals, and absenteeism. Here are some of the data elements that are collected within an HRIS. I'm not going to read them all to you, but just when it comes to this chapter, the biggest key is being able, you may see questions on the RHIT exam or even on quizzes or tests in this class asking like which IS collects this type of data, the hire date, the termination date of employees. That should clue you in that that is the Human Resources Information System. So you need to just be aware of the different data elements that are included in each IS. Okay, this is also more reporting and tracking that is done in the HRIS, so anything to do with employment. Okay, so HR will also track mandated classes and training for all employees. So for clinical staff, they'll make sure they have their CPR certification up to date, that they took the annual fire and safety, OSHA standards, and privacy and security modules and passed them and turned in their certificates. Okay, a decision support system, DSS. This is a IS that gathers data from a variety of sources and assists in providing structure to data. So what it does is facilitate and improve the outcome and decision-making tasks associated with non-routine or non-repetitive problems. So decision support systems and big data. So use of these analytic techniques include different types of data. So they could use structured, semi-structured, and unstructured. And when we talk about big data, it's a term for data sets whose size or type is beyond the ability of traditional relational databases to capture, manage, and process the data. So DSSs utilize the data in data repositories and data warehouses, and typically what the types of reports and analysis ran would be what-if scenarios. Like, what if we got another MRI machine? What would that look like for wait times? What would that look like for staffing? Those kinds of questions would be answered. Okay, business intelligence. This is a broad category of applications and technologies for gathering, storing, analyzing, and providing access to data to help users make better business decisions. Okay, another type of decision support system would be your Executive Information System, EIS. So this support system is used by healthcare administrators, and it has to be easy to use and have access to a wide range of data. Internal data and also external data. Some advantages of an EIS. It can help improve competitiveness of the healthcare organization, knowledge of how the healthcare organization works, making information available to authorized users, and helps make strategic decisions. Okay, enterprise information systems. These have a dashboard which gives reports to administration structured info to make intelligent decisions for the future. They can view detailed data by types of graphs that are selected depending on what software is used. And data from the EIS is a visual representation to administration of where the problem is greatest and where the priorities should be focused. So this is all about, more strategy and future planning. KPIs, key performance indicators. These are critical measurable objectives that assess how well the healthcare organization is performing. So typical healthcare KPIs would be like bed occupancy rate, average length of stay, claim denial rate, training by department, patient confidentiality breach rate. Next we have MPI, Master Patient Index. This should be familiar from previous classes. This is part of the Health Information System. This is a patient identifying directory referencing all patients related to a healthcare organization. So it serves as a link to patient health record or information and facilitates patient identification. MPI assists in maintaining a longitudinal patient record from birth to death. MPI identifies every patient who has been admitted to the healthcare organization and helps locate all patient health records. It's basically a master patient list. MPI is kept permanently, which is mandated by legal statutes. They include both demographics and visit-specific information, and it's a database of every patient visit in the history of that healthcare organization. Okay, within the Master Patient Index, there's Soundex, which is a phonetics-based indexing, which looks for overlays. It could look for duplicates. There could be hundreds or thousands of patient visits depending on the age of the healthcare organization. Okay, eMPI, Enterprise Master Patient Index. Integrated delivery systems typically have eMPIs. IDS is an organizational arrangement of a network of healthcare providers. So IDS is Integrative Delivery System. So this includes hospitals, physicians, and HMOs. They provide coordinated services along the continuum of care, which can be ambulatory, acute, or long-term. So what it does is it provides access to multiple repositories of information that are maintained in separate information systems. So it's basically integrating systems so that doctors in different locations would be able to view this patient information. The impact of MPI and eMPI and HIM. So HIM is the key user of the eMPI to look up health record numbers, identify discharge dates, confirm that health records contain all patient visits, merging of health record numbers, correcting errors, looking for overlays. Next, we have the patient registration, admission, discharge, transfer. So this is known as RADT. This includes daily admissions, discharges, census report, transfer list, bed utilization reports. Basically, it tracks every admission, every discharge, and where a patient was transferred: home, long-term care, skilled nursing facility. Okay, scheduling system controls the use of resources such as staff, equipment, rooms throughout an organization. It can be centralized, which allows for scheduling of all services. So one call center making multiple appointments, or decentralized, which is location specific. Practice management system is used by physician practices, and it does everything they need to manage their practice, such as scheduling, accounting, collections, submission of claims, appointment scheduling, human resources, and any other functions that are built into this. So HIM professional in physician office manager roles utilize the practice management information system in all these different ways, by looking at the financials, the master patient index, charge master, entering codes for billing, reporting, tracking patient visits, etc. Materials management system. This is how a healthcare organization manages a large amount of equipment and supplies. So it typically automates the purchasing process, inventory control, menu planning, food service. The functions of it is creating requisitions, gaining necessary approvals for purchases, comparing the purchase to the budget to make sure funds are available, or automatically ordering supplies that they know are needed. They could generate barcodes to be applied towards supplies to be used and charged to the patient correctly. Facilities management system is our last one. This is a physical plant which requires, constant maintenance and upgrades. So it keeps track of the building structure, surrounding grounds, parking lots and decks, building equipment such as elevators. The facilities management system is used by a healthcare organization to manage all aspects of the physical facilities and plants. So they track routine maintenance, making sure elevator inspections are up to date, fire extinguishers are where they're supposed to be and maintained, any preventative equipment maintenance, making sure that equipment lasts as long as possible. HVAC system, this is part of facilities management. Doors that are locked and unlocked automatically, employees being given access to restricted areas. So those are all the different types of administrative information systems. Like I said, the key is to be able to recognize which system does what.